Upper right abdominal pain is common condition. We can divide our abdomen or our stomach into 4 imaginary quadrants, and we will discuss right upper quadrant. Most common cause of upper right abdominal pain is gallstones. It occurs and it's responsible on 40% of cases. So if person has severe upper right abdominal pain, first we suspect is gallstones. It also called biliary colic. Biliary colic is sudden severe pain which can radiate into back or right shoulder, and it happens why we have gallbladder located on the liver, and sometimes in gallbladder gallstones are created. These gallstones can travel into biliary duct, and it can obstruct gallbladder, and this obstruction causes inflammation and pain. That's the idea. So gallstones are responsible in most cases of biliary colic. This pain is sudden, severe, sharp, radiates, and usually it's after high fat meal, so it is correlated with meal. Also, Murphy sign is positive. What is Murphy sign? When you press here person, and person inhales deeply, pain occurs. So pain increases when doctor palpates on gallbladder location or liver location and press the abdomen, and when person inhalates or inhale, this pain increases. That's Murphy sign, positive Murphy sign. Positive Murphy sign confirms gallstones or biliary colic. Second most common cause of upper right abdominal pain is gastritis or peptic ulcers. Now let's say what it is and what type of pain they have. Usually this pain is on empty stomach, and person usually don't say that he or she has right upper abdominal pain, but in most cases he feels pain in the center of stomach or slightly left. But sometimes patients say that they have right upper abdominal pain. Pain is burning sensation and aching type or gnawing sensation. Pain middle night. It confirms also a peptic ulcer or gastritis, or pain on empty stomach, because when person eats this food dissolves gastric acid and pain relieved. That's why empty stomach pain is common in case of peptic ulcer. What treatment we have during peptic ulcer? We have H2 blockers and antibiotics. Now let's say what is third most common cause. It's food poisoning. Food poisoning also can cause right upper abdominal pain in 10% of cases. Of course, these percentages are not very accurate. It depends, but it gives us general vision and general understanding what we should suspect if we have patient with right upper abdominal pain. What we should suspect first, second, third. In case of food poisoning, pain usually diffuse. Pain usually don't locate in one point. It's on whole stomach, cramping pain, and it occurs shortly after consuming contaminated foods or drinks. So it's correlated with eating, and person has these feelings, nausea, vomiting also after eating, and usually this pain is diffuse and don't localized in upper right abdomen, but sometimes patient can indicate this part. Fourth, we should suspect it's appendicitis. Generally, appendicitis causes pain lower part of abdomen, lower right part of abdomen, but sometimes it can patient can feel this pain upper part of abdomen. Usually this pain starts around belly button and then moving to the right lower part of abdomen, but sometimes it can be felt on upper part. This pain worsens during movement, during breathing, coughing or sneezing, and patient have tenderness. When you palpate his or her abdomen, you feel tenderness or hardening of stomach wall. Another disease we should suspect is liver disease. It's not very common, maybe around 5% of cases, but we should exclude this disease. And why is not very common? Because liver has few pain receptors, so liver pain itself is rare until this liver is not enlarged enough to press its capsule, and this causes pain. But at this case we already have important signs and symptoms like jaundice, dark urine, pale stool, and liver functions also not normal, AST and ALT. So if person has, for example, cirrhosis or hepatitis, they usually have other symptoms also except right upper abdominal pain, because it's not first symptom. Another disease we should suspect is kidney stones and kidney disease. It's less than 5%. Why? Because usually kidney stones and kidney problems causes pain back, not front part of abdomen, but back pain. But sometimes, and they cause pain lower part of abdomen, but sometimes patient can describe it as an upper right abdominal pain. Pain usually sharp, severe, comes in waves, and movement, rest does not help. So patient can't find a comfortable position. It tries, it moves, and the movement does not increase pain, but it also does not help. So you can differentiate it from appendicitis. In case of appendicitis, movement increases pain, but in case of kidney stones, patient can't find comfortable position. And also rare is gastrointestinal cancers, for example pancreatic cancer or liver cancer, but we should exclude this also. It's less than 5% also, and we should exclude because the symptoms usually are confusing, non-specific. That's why it's vague, and that's why it's difficult, gastrointestinal cancers, and difficult to suspect. But usually this pain gradually increases over time, and patient has weight loss, loss of appetite, nausea, vomiting, and of course when patient feels pain, it's already late in many cases. But we should still pay it attention, and we should still exclude this condition. So now summarize. First, when patient comes with upper right abdominal pain, we think about gallstones and biliary colic. Another, gastritis or peptic ulcer, food poisoning, appendicitis, liver disease, kidney disease, and gastrointestinal cancers. That's most common parts. Of course, IBS and inflammatory bowel disease also can cause right abdominal pain, right upper abdominal pain, but this pain usually lower part. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.